Alright, I'm going to be doing 3 shoulder tests here. So I'll have my patient supine. I'll bring him into 90 degrees of shoulder flexion and internal rotation, and I'll flex him at the elbow. Use one hand to palpate the posterior head of the humerus, and the other hand to provide a downward translation force through the elbow. And a positive test would be if I feel instability, or if the patient experiences pain or apprehension or clicking, which would be indicative of posterior instability of the shoulder. The second test, I'll have the patient in the same position, palpate the posterior head of the humerus, provide a downward force to the elbow, and then I will adduct the patient's arm across his or her body. A positive test would be if there's a jerk sensation felt, which is the humeral head subluxing or dislocating out of the glenoid. And then I release the force of the elbow and bring them back to neutral, and the same jerk should be felt, which would be the humeral head relocating in the glenoid. And then the final test would be, that was the jerk test. This final test is the posterior glide at 90 degrees, so I'll bring the patient into 90 degrees of shoulder abduction. Use my axilla, put his hand in my axilla to hold his arm up, and then use one hand to palpate the posterior humeral head, and the other hand to provide a posterior translation force at the humeral head. And a positive test would be pain, apprehension, or instability, which would be indicative of a all these tests are indicative of posterior shoulder instability.